Although the laryngeal oral airway was really designed to enhance IV sedation cases, it really dawned on us that it's the perfect airway really for post-anesthetic care. For example, on our patients, if they're still somewhat sedated following the procedure, they'll move to our recovery area and they will still have the laryngeal oral airway in. That means that in the recovery area, they can still have excellent oxygen delivery and excellent capnography. That's actually true any case post-extubation at any facility anywhere. So if you're doing general anesthetic cases, removing an endotracheal tube, removing a laryngeal mask airway, and you're going to be transitioning the patient down the hallway to the recovery area, popping an airway in to maintain that airway is kind of routine, so you know that the patient will do well in transit. It's actually preferable, and really it's been kind of the rules and guidelines have been set that there should be the capacity to deliver oxygen effectively in transit. And just having an oxygen cannula, for example, in the person's nose is in no way going to be delivering it as effectively if you're having it seated within the well of the laryngeal oral airway in transport. And when you've reached recovery room, if the patient's still in significant sedation at that point, it's important and really something that is in the anesthetic rules that you should be able to effectively measure capnography in the recovery area. And there's really no other good way to do it presently besides the laryngeal oral airway, and it does it beautifully. So you can extubate, put the LOA in, provide oxygen in transport, and then when you connect to the monitor in the recovery area, you can measure capnography until the patient becomes alert enough. And with that airway in, they'll be comfortable and you'll be able to see that they're awake enough for it to be removed. And at that point, you don't need to have that capnography anymore. So, yep, it's the perfect airway, I think, for IV sedation cases, but really also the perfect airway for post-extubation, transport to recovery, and early capnography in the recovery room.